Knee injuries can sideline anyone from gym goers to elite athletes. And today, a sports injury surgeon joins us to break down the most common knee injuries and how modern procedures are getting people back on their feet faster. Please welcome Dr. Frederick Wong from ProLiance Orthopedic Associates. Hello.
Hi, thanks for having me, Kelly.
Thank you for being here. So I imagine you see sports injuries all the time and of all kinds. So what are the most common knee injuries that you see?
A few of the most common knee problems that we see when people are doing sports are meniscus tears, ACL tears, and kneecap dislocations or patellar dislocations.
Oh my goodness. Okay, and what are we seeing there? Some knee anatomy?
Yes, the knee is a pretty remarkable joint. People think it's a simple hinge, but it actually has a lot of complexity to it. And there's different structures that give you importance in terms of stability and cushion effect. There's the meniscus cushions, one on each side. There's a ligament. The most famous one, of course, that everybody hears about is the anterior cruciate ligament, or ACL. And then there's the kneecap in the front.
Okay, and what are the common treatments that you recommend to your patients?
Well, you can imagine if your kneecap pops out of socket over here, then we might recommend some physical therapy exercises to make your muscle stronger, to keep the kneecap aligned better. Sometimes we do need to do surgery for that. If you tear a meniscus, those are the structures in here on the two sides. They often require surgery as well to either trim or fix them. And then if you tear your ACL, one of the central ligaments that's really important, you often would have to have surgery to rebuild that ligament to give you a more stable knee.
What about a knee replacement surgery? When does it get to that point? Because my dad was a big marathon runner and he had to have 2 knee replacements.
So arthritis of the knee is extremely common. Basically, any cartilage damage over time will build up, and sometimes that's due to an injury, other times it's just wear and tear of the body. But when arthritis gets very severe and you have large areas of bone touching bone, then yes, a knee replacement like this would be the next step. So that's metal and plastic pieces to give you new bearing surfaces of your knee. And we've made a lot of strides in knee replacement surgery, and this is one of the most common surgeries I do because knee arthritis is so prevalent.
Oh my gosh. Okay, and how long would like a knee replacement take for like recovery too after the fact?
We're getting better with different modalities to help people speed up their recovery, but in the end it is still time that you just have to be patient, diligent with your exercises. And I tell most people, be ready for an 8 to 10 week recovery at a minimum after knee replacement surgery.
But then it makes all the difference. My dad can attest. He's out hiking now. It was the best thing that he ever did. You hear people complaining about knee pain all the time. What could that be from? And of course, we must know how we can prevent it then.
Yes, one of the most common problems that we see with regards to knee pain is a patellar pain or anterior knee pain. So this is a problem that almost everybody experiences at some point in their life. So it's usually due to overloading of the front of the knee here. And that is due to repetitive running, jumping, squatting, kneeling, sometimes due to an injury, but a lot of times just an overuse problem. So the best way to figure out if this might be what you're having is a simple test that I do in patients all the time, or I have friends do it when they come ask me at a dinner party.
I'm sure you get a lot of that.
If you stand on one leg and then you just simply go down a couple inches and back up, and you do this 3 or 4 times.
Right.
If you do it on a knee that's not bothering you, and then you switch over and try it on the knee that's bothering you, and if it causes pain, especially pain in the front of your knee, then you may be having some pain at your knee due to this kneecap overloading or patellar pain problem.
And what exercises can you do to potentially help with this or
Great
prevent?
question. To avoid having to immediately dash in to see your doctor, try some simple stretching. So the best exercise to prevent this or to get over this is, I tell people I'm old, but I can still do it, heel to butt. So the heel to butt stretch about 3 times a day, holding it for about 10 seconds, spending about 10 minutes 3 times a day to stretch your quads. And then some simple quad strengthening. People do shallow squats, not too deep, or some wall squats. These are great ways to get over this problem, and if you get better quickly, then that's probably what was causing your pain.
Ooh, we love to hear that. Okay, and what does ProLiance Orthopedic offer to its patients?
We're a comprehensive group. ProLiance Orthopedic Associates has a main office in Renton, down south, King County, but we also have an additional 5 other office locations scattered about, where we provide outstanding orthopedic care, comprehensive joint problems, spine problems, hand, foot and ankle. We also have 2 MRI scanners We have one physical therapy location, and we're going to be getting a second one hopefully within the next few months. And then our most thing that we're proud of is our ambulatory surgery center, outpatient surgery center, day surgery for orthopedic problems.
Wow, amazing. This was so insightful. Thank you for being here, doctor.
Thank you again, Kelly.
Yes, and for more information and to find a doctor, just visit the website that you see right there on your screen.
New Day Northwest is sponsored by ProLiance Orthopedic Associates.